I'm Dr. Thomas Biggs, and I'm from Houston, Texas. I'm a clinical professor of plastic surgery at Baylor College of Medicine. I'm former president of the International Society of Aesthetic Plastic Surgery, former editor-in-chief of the Aesthetic Plastic Surgery, and currently a happy promoter of silicone implants with polyurethane cover. Back in the 80s, our major problem that we had with breast implant surgery was fibrous capsular contracture, which, by the way, is still our major problem. And I was introduced to the fact that polyurethane would minimize that, if not eradicate it, by a friend of mine named Rod Hester, Dr. Rod Hester from Emory University in Atlanta. And so I had a patient who had been operated upon 8 times, not by me, but by other people, and it was just terrible. And so I told her that I'd never used this implant before, but I had a feeling that it was what she needed, and she said, well, do it. So I did, and I resected the took the implant out, resected the capsule, put in a polyurethane implant, and she was soft and stayed soft. And I last saw her after she was 5 years post-op. She was super soft. So I call that a victory. And because of that success, I thought, well, I'll do this again. So I did 2 or 3 more of these chronic recurrent capsular contracture cases. And then the light went off in my head, and that is, you know, if it really works so great in secondary cases, why not just use it in primary cases? So that's exactly what I did, and I had over 600 cases using the polyurethane before it was taken off the market. So I had a very successful round with it. I didn't adequately and appropriately follow up all my patients. They came back. I said to please come back, but they came back when they wanted to come back. And anybody who had a problem came back. People without problems didn't want to come back. And so I didn't really see a lot of these people after the first year, except when they came in wanting a facelift. And that was 10, 15 years later.